Hello, and thank you for the opportunity to speak today on COVID-19 and globalization, challenges and opportunities. What you see on the upper left-hand panel are the global air routes. What you see on the right-hand panel is the global spread of SARS-CoV-2, and you notice that the two bear some relationship. In fact, the benefit and ease of international travel has facilitated pandemic spread in the past and did facilitate spread of COVID-19. What you see on the bottom panel are the total number of cases worldwide and the total number of deaths worldwide. These continue to climb, and countries are struggling with second or third wave of COVID-19 infections and now increasing mortality rates as well. But the economic challenges of globalization were never clearer than in COVID-19. The World Bank at one point estimated that the cost of pandemics in the 21st century would total $6 trillion. We know now that that is an underestimate. The IMF estimates that COVID-19 has presently cost the world $28 trillion. So really, COVID-19 has been about striking balances, and all of these have potential implications for the economy and for globalization. Freedom versus protection. Nationalism versus internationalism, science versus populism. What you see in the bottom right-hand side is an estimate of the total trade impact of coronavirus 19 on different countries and regions of the world, the European Union, the United States, Japan, Republic of Korea. Globalization has enormous benefits, but with COVID-19, globalization has tremendous costs as well. But as we look at COVID-19, let's think about where we are today in November of 2020. From 180 plus candidates, we now finally have signals of efficacy, that is, prevention of infection or death or disease. Those three companies are listed in the box. Pfizer-BioNTech with a vaccine efficacy of 95%. Gamaleya, a Russian company with a vaccine efficacy of 92%. Moderna, with a vaccine efficacy of 94.5%. And I think many of us expect to hear more, perhaps from Chinese companies or other companies that are currently involved in phase 3 trials of COVID-19 vaccines. When we think about this, what do we really have to go on? Well, we can look at neutralizing antibody titers. Neutralizing antibodies are those class of antibodies, infection-fighting proteins made by the immune system, a defensive response, that bind to and inactivate viruses. And you can actually break the companies in phase 3 into 3 tiers of levels of neutralizing antibody. The more neutralizing antibody you have, the hypothesis goes, the better off you are. So at the lowest level, with titers detectable but under a level of 100, are CanSino, Sinovac, and Gamaleya. With titers between 100 and 500, you have Johnson & Johnson, Sinopharm, AstraZeneca, and Pfizer. And with titers greater than 1,000, you have Moderna and Novavax. Now, we know that at least 3 companies, Gamaleya, Pfizer-BioNTech, and Moderna, all have vaccine efficacies above 90% at 2 months, and with safety information at 2 months. But what this tells us is an important proof of concept that a vaccine against COVID-19 is possible, and also, importantly for Moderna and Pfizer-BioNTech, that an RNA vaccine against COVID-19, a first proof of concept for an RNA vaccine preventing an infectious disease. The second thing that we could potentially base judgments on are protection of monkeys against infection. So in this case, you vaccinate monkeys, you challenge them with SARS-CoV-2, and if they're protected, then it might suggest that, that the vaccine will work in humans. And in fact, all of the vaccines, except for CanSino, which hasn't reported results yet, all of the vaccines shown on the left-hand side of the slide all have data that show protection in monkey challenge models. So again, there's a lot of hope here that given the levels of neutralizing antibody that we're seeing in the vaccines that do protect, that perhaps other vaccines will protect as well. If you look at the key candidates now, and this slide is important for one reason, it shows you the time, the speed with which vaccines were developed. So Moderna, shown in the top part of the slide. The first circle is when Moderna's vaccine was first introduced into humans. So the first in human study, the phase 1 study, started in March. By the end of April, we had data reported on immunogenicity. Is the vaccine making the correct protective responses? By the end of July, that vaccine had entered phase 3 trials for efficacy and for safety. And the hatched bars at the very end show when vaccine production started to occur. Now you can see that many other vaccines have first in human dates, also have first reported immunogenicity dates, but importantly, a number of the vaccines have started production at risk. So what's shown in the yellow stars are companies that received approval, emergency use approval from Russia and China before efficacy was shown. And what you see in the red are the companies that have since reported both safety and efficacy data at a 2-month time frame, and that includes Moderna, BioNTech, Pfizer, and Gamaleya. So we've managed to develop vaccines with unprecedented speed. Others are probably expected soon. But what does this mean? How were they funded? If you look at the funding for many of these vaccines, not Gamaleya, but many of the others, almost all of them receive funding from the $18 billion program that the US government calls Operation Warp Speed. But Operation Warp Speed is not a global program. It's a program focused exclusively on the development of vaccines for the United States. Now that may change, but currently we're focused on the United States. So this is an unfortunate example of vaccine nationalism. The CEPI funded vaccines, so CEPI had $1.4 billion to give to COVID-19 vaccine research and development, is global. It's a group of countries and organizations that have put together funding that will not only develop vaccines against COVID-19, but also commit the companies to some form of global access and to selling the vaccines at a reasonable cost. And then you have an international mechanism for dispensing vaccine. The COVAX facility, led by WHO, Gavi, and CEPI, the Coalition for Epidemic Preparedness Innovations. And COVAX is really a mechanism now, for the first time, to grant access to innovative vaccine technology concurrently in low and middle income countries at the same time the vaccine is being introduced into high income countries, in theory. Many Operation Warp Speed companies were also funded by CEPI. And that's an important point, because the $18 billion that the US government put into the development of vaccines has so far shown success. The vaccines from Pfizer-BioNTech and from Moderna were funded by Operation Warp Speed. Similarly, AstraZeneca's vaccine, Moderna's vaccine, Novavax's vaccine, and Novio's vaccine were also received funding from CEPI. And remember that CEPI funding comes with an international or global perspective on access and equity and on price. So a lot of people talk about the vaccine companies and the race to develop a vaccine and how this is somehow tied into national pride. I just wanted to show and make an illustration here. What you see in the red dots are the companies. And you can see they're companies scattered all over the world. And I think this is what people focus on. But what they don't fully appreciate is the idea that Johnson & Johnson's vaccine branch is Janssen, which is in Europe. Sanofi has research sites in North America and in France, and manufactures vaccine in Belgium. Other companies also have very broad footprints, and you can see Sanofi and GSK listed there, but as well, you know, I think the point to make here is that it's difficult to call Sanofi a purely European company, since its research and development is partially done in the United States, or GSK, which has efforts ongoing in multiple countries as a part of its support for COVID-19 vaccine R&D. Similarly, Johnson & Johnson. Novavax, which doesn't really have its own manufacturing capability, and many of the other companies as well, in order to improve their global reach, have contracted or licensed out vaccine manufacturing all over the world. So truly, COVID-19 vaccine research and development, and importantly, COVID-19 vaccine manufacturing will be a global affair. Again, emphasizing how COVID-19 has taken what we have had to do, manufacture, 16 billion doses of vaccine and made it a truly global effort. Another great example of COVID-19 and globalization is the multilateralism that is a part of CEPI, the Coalition for Epidemic Preparedness Innovation. In this case, a number of countries, organizations like the European Union, philanthropic organizations like the Gates Foundation and the Wellcome Trust have put together funding to not only fund work in COVID-19, but also in the Middle East respiratory syndrome coronavirus, Nipah virus, Lassa virus, chikungunya virus. Indeed, CEPI was the first out of the blocks. CEPI funding was made available initially to 4 companies within 2 weeks of announcement of the sequence of COVID-19. Again, a great example of multilateralism, of globalism in action to confront COVID-19. More on COVAX. More than 190 countries have joined COVAX, which is organized by CEPI, Gavi, and the World Health Organization. It's coordinated by Gavi under the ACT accelerator activity that Gavi is responsible for. 92 low and middle income countries could be supported by the COVAX advanced manufacturing commitments. 2 billion doses of WHO pre-qualified vaccine will be available to all of the 192 countries that are part of COVAX by the end of 2021. This represents roughly 20% of need. So COVAX in theory is a great idea and really is the best way to ensure that low and middle income countries also benefit from vaccine innovation developed as a result of COVAX-related vaccine R&D. The flip side of this, though, is that 8.8 billion doses have been pre-ordered, primarily by high-income countries. And current models predict that we won't have enough vaccine until 2023 or 2024. Unfortunately, modeling suggests that if high-income countries take the first 2 billion doses of vaccine without any distribution according to equity, we will see double the number of global COVID-19 deaths. So really, globalization will save lives. Then we have to consider the global opposition. Who opposes vaccination? Well, vaccine nationalism, vaccine imperialism, vaccine security, to some extent also impairs the ability to share vaccine broadly across countries. The infodemic, the idea that we were using an argument of urgency over objectivity, the COVID conspiracy theories, unfiltered, unreviewed science sometimes stood in the way of true and frank discussion of the data. Anti-science with its misinformation, rejectionism, vaccine hesitancy, and finally, politics. The politics around partisanship, miscommunication, and the economic hardship experienced by many people around the world have created a sense that maybe this was all a manufactured crisis. In fact, we need to oppose this with the science around COVID vaccines, around the safety and efficacy of these vaccines. We have to be transparent. We have to believe in internationalism and globalism, and in the ultimate triumph of public health and global health, of vaccines as a global public good. So the unfinished business, the weeks after efficacy, we now have 3 vaccines that show efficacy and safety, and the coming weeks will likely bring more. But what does the day after efficacy look like? Well, who is going to make this vaccine? 16 billion doses. How are we going to assure access and equity in allocation? How are we going to use the vaccine correctly? The other big questions, have we had time to optimize the dose of the vaccine to maximize magnitude and durability? Do we know how to do boosts? Can we give a person the AstraZeneca vaccine as the prime and use the Pfizer-BioNTech vaccine as a boost, or vice versa? You know, what will it look like if we vaccinate people who already have had COVID-19 infection? Would there be benefit or risk? We don't know what the vaccine correlates of protection are. We also don't really have real-world evidence. Remember that phase 3 trials are uniquely designed to look at individual effects. Is the volunteer protected against infection without bias? But in this case, we might also want to know whether vaccinating a person protects his or her family. So we need to look at community protection, at effectiveness, at what would be vaccine-induced herd immunity. And we will only see that if we change the design of the trials to look specifically for vaccine effectiveness. We don't have much information on long-term safety follow-up or post-licensure safety. So vaccine-associated adverse events or adverse events following immunization. We don't really have data on that, and we need to collect it for a few years after vaccines are introduced. What will be the implications of licensure and emergency use? Will that change what we can do in phase 3 trials? Will we still be able to compare vaccine against placebo? Will we need to increase the size and complexity of trials by doing non-inferiority designs? What will the impact of the people who are opposed to vaccination be? And finally, and it's not listed on this slide, but will we be able to continue surveillance? Surveillance for new strains of coronaviruses that hop into the human population that may or may not be susceptible to the current crop of COVID-19 vaccines? And will there be mutants that emerge from the coronaviruses currently in circulation, perhaps by ping-ponging back and forth into animal species that would, again, show resistance to the vaccine-induced immune responses from the current generation of COVID-19 vaccines? Again, there's work that needs to be done on continued surveillance. I think it's very important to recognize what UN Secretary General Guterres said: no one is safe until everyone is safe. Highlighted in yellow are those things that really require global efforts. So again, COVID-19 has changed the way we look at the world and at each other. And hopefully the lessons learned from COVID-19 in terms of globalization, in terms of the global economy, in terms of the rapidity of vaccine development when global efforts are put together, should be a reminder that we can do this, and that efforts like COVAX, which hope to ensure vaccine access and equity for people around the world, are going to be the final triumph of globalization over COVID-19. Thank you.